What's up, guys? Sorry. Trying to eat. But definitely, what's up, guys? It's Dominique, aka that therapist. For those of you that don't know me, I'm the lead clinician and CEO for a group practice known as Yellow Bird Counseling. Well, what is that? What's the Yellow Bird Counseling? Well, our normal day-to-day activities include providing individual, couples, family, and group therapy in the state of Alabama. Okay. To children, adults, couples, elderly, young adults, adolescents across the lifespan. So that's what our normal day-to-day activities consist of. But what do we do here for social media on Thursday? Well, every Thursday evening at 8 p.m. Central Standard Time, which is 9 p.m. Eastern, which is 6 p.m. Pacific, which is 7 p.m. Mountain, we educate the general population on reasons that we all could benefit from having a therapist outside of simply just having a mental illness. Because people tend to think that you have to have a mental illness in order to see a therapist, and that's not always the case. There are several opportunities and circumstances in which a person might see a therapist who does not have a mental illness, right? So those are the different things that we educate you on, and also bring awareness to things that you might not have thought about, such as suicide prevention. This month is Suicide Prevention Month, so we've been doing a series on just different ways to bring awareness to suicidality. Last week, we talked about resources that people can utilize to help with suicide prevention or assist with suicide intervention. We also talked about how community involvement, or you being a part of a community, you could assist with suicide prevention around your own communities or communities that are larger communities. And then the first week we discussed warning signs and ways to engage those warning signs if you do see any suicidality in yourself, friends, or family members. So those lives are definitely available if you want to go back and watch them. They are on our Facebook page and also our Instagram page if you would like to go and watch the lives that we did from the previous weeks. But we really do want to spread the word about prevention and intervention and awareness. And so the best and easiest way we could do that is if you will help us in sharing the live. If you could pick at least 2 different ways to share, one sharing on the platform that you're on, and then maybe copy and pasting the link into maybe a text message or messenger or a DM, if you could do that to help us share the live that way. Those of you that are in the community and receive the text, it's super simple for you to just copy and paste that text link somewhere to a friend, family member, a group that you're in, anywhere, to bring people in so that we can increase the amount of awareness that we build around this topic. This is very, very crucial in order for us to really fight against the epidemic of suicidality, really. You know what I'm saying? So we just can do the best that we can. And at the very least, we can help someone else become aware. So if you don't mind sharing the live, please share the live to help us bring awareness around this topic. This evening, we're going to discuss our youth population, as that is one of the most vulnerable populations for suicidality, and especially for preteens. The number of preteens engaging in suicidal behavior, having suicidal ideations, continues to increase exponentially if we look at different statistics and data. So I think that first, let's really give people an idea of how suicidality has increased in youth population over the past, we'll just say 10 years. We'll just do that. Okay. If you know parents or teachers or people that work with children, this might be a great time for you to share this live with them, or people that work with children. Maybe you know a pediatric nurse or something like that. It would be great for you to share the live with those types of people. All right. I'm going to just see. Let me see. Does this one? Okay. Yes, this is good. From the CDC.gov. Always go to CDC. CDC is the best. So we're looking at suicide mortality in the United States 2002 to 2022. So I just want to show the graph really, so that we can, well, this is per 100,000, but it doesn't tell the ages. I really want to see age adjusted. This was supposed to just bring up children, but it's still a good graph. But let me see if I can find the graph for youth that specifically talks about youth. Let me go back. Hold on, guys, because I want to be sure that we're using a comprehensive graph of the information we're trying to find. Yeah, it was giving me general. Here we go. It has a graph on the site I was just on, but this will probably take me to something quicker. Okay. Of course, we do like to use mentalhealthnational.org. Mental Health America is the source. Let me go. It's ranking all the cities in order of their number of completed attempts, but that's not what we want. That's not what I wanted. I wanted okay, youth ages 6 to 17. Man, it only breaks it down by state. Okay. See, this one shows it, but it doesn't show. Okay, the report. Okay. All right. So we switched to the National Library of Medicine, guys, for our source review. Okay. So the age, let me look. It doesn't say what ages is this. I'm trying to tell y'all what the age range is. Okay, well, I'm just going to have to explain it. Okay, ages 15 to 19. We've got ages 10 to 14. Okay, perfect. Perfect. This is good. All right, let me bring it up for y'all. I was going to have to explain it to the other people anyway. But let me bring this up for y'all to see. And I'll talk through these numbers with you. All right, so let's look at this, the statistics, for age 10 to 14 first. So it breaks it down by method. So those of y'all that are looking, you can look right here. These are the methods. So for this particular method here, we see that there's a gradual increase over time, but definitely what we want to focus on is this is per 100,000, right? So we see like that 100,000 increase pretty steadily from 1998 to 2020 has gone up. It looks like it's increased. Let's see, from 1998 to 2020, this is 100. It went from a little over 100, well, almost 200,000, right? To 2020, looks like closer to 300,000. So another 100,000 added over that time, which is a lot. This particular method here went down. I don't know what was going on in 2008 to help bring that down, but from 2008, where it was below 100,000 using this particular method here, by 2020, it had increased to almost 200,000 by the use of this particular method, right? You see that? And then there's a steady increase of even more steady than this method for this method here. And it's three different methods. And so one is pew pew, one is poisoning, and one is other things that I don't want to say, right? Cutting off air of some sort, like suffocation. So the poisoning goes up for kids 10 to 14. So we may want to think about like what kinds of substances our children have access to, because that has increased. That's the most steady increase. There has been like little declines in it, little dips, but overall that particular method of that children in this age group use is poisoning. So we definitely want to be sure that we're aware of what kind of substances that we're leaving around our children and letting them have access to, right? Just in general, but definitely if we see any of those warning signs that we talked about week 1 with suicidality, right? And we'll talk more about specific warning signs also for kids around this, but I wanted to start our discussion with showing you or talking through the increased suicidality over time for youth. So we're just talking about from 1998 to 2020. Okay. So now let's take another look at 15 to 19. So there's not as much of a of a evident increase as there is with preteens, ages 10 to 14, but still nonetheless, we do see a progression, a number increase for like suffocation efforts. There was a dip in 2020. I'd have to look for 2020 to present, but we do still see a gradual increase for other means. So definitely overall a general increase, but there are some methods that became less, that there were less successes with. So we definitely want to provide education around all methods, though. We want to provide education for children and parents around usage of pew-pews, usage of lethal substances of any kind, things that humans aren't supposed to ingest, right? We want to talk about prevention and intervention around different types of suffocation, and just generally talking around these methods, because these are the methods most utilized for individuals 10 to 19, which is the age group that we're covering, right? So we definitely want to have more conversations around that. Maybe if there's specific questions around that, based on maybe you might monitor your children's behavior around these particular things. So, if you're a parent that has, teaching your child how to hunt, and they're exhibiting signs and symptoms of suicidality, you might want to, lock some stuff up that they can't use, and you don't give them the combination to, right? That's just one example. Or if you lock up all your cleaning supplies and medications with where it's only accessible to the adult. And based on your child's age group and your child's level of wherewithal, what levels of precaution you need to use for your individual child. So just bringing that up, letting people kind of see a little bit of statistical analysis around that. Yeah. So let's see if there's any questions. Is there any questions that y'all have as far as the statistics around youth suicidality? Any questions? I'm looking at all platforms. Do you have any questions? Okay. No questions. All right, let's keep going then. If you don't have any questions, we'll just keep going. So let us talk more about what are things that we want to look for when talking to youth about suicidality, or things that we want to highlight. Definitely, I think the statistical part of it. Let's talk about risk factors, okay, with youth. Let's talk about it. What are some things that put people at risk of this age group? And for this particular article, they're outlining tools to help prevent youth suicide. That's what we're highlighting. But as far as the age group is concerned, we're looking at ages 15 to 24. So let's talk about some of those risk factors that affect this age group, ages 15 to 24. And if you want to know the source, this is apa.org. And the article is Talking to Teens, Suicide Prevention. So I only use reputable sources for this kind of thing on Mental Health Thursdays, because we want to be sure that we are presenting information that is correct and aligns with the field that I practice in. So this is from American Psychology Association.org. Okay. So do be mindful that your child or young youth loved one doesn't have to experience all of these symptoms, but these are some of the symptoms that you can definitely, that you would want to take heed to if it's something that you see, right? So physical changes, such as changes in appearance, like how they might dress, or changes in their hygiene, maybe a decline in their hygiene, okay? Increase in alcohol or drug use. Maybe you have some suspicions around their substance use. And if they are testing positive for any substances, this is definitely a warning sign or a risk factor that could increase suicidality, possibly, right? Sudden drop in grades. Maybe they were like an honor roll student and now they're not, they're having difficulty barely passing, or maybe their grades are just not as consistent or reflecting the performance that you're used to them exhibiting, right? Social withdrawal. So maybe they're not hanging around friends or going to, functions like they used to. They're wanting to stay more inside and to themselves. So that's something that you would want to look for with youth. Talking about suicide or preoccupied with unaliving. So they're having a lot of conversations about life ending in one way or another. And you notice that the conversation is happening more often than not. Okay. Maybe they're engaging in risky or reckless behaviors, such as reckless driving or unsafe intimate encounters, right? Risky intimate encounters. And you can see that some of these risk factors are some that also we see with adults too. But just so you're aware, specifically for this age group, things that you would want to look out for. But a lot of these coincide with just the general risk factors and warning signs we would see, period, with suicidality. Self-harm behaviors such as cutting, talking about feeling hopeless or having nothing to live for. That's a big overlap across all age groups. Researching suicide methods and or acquiring weapons. So that would be another risk factor or warning. May put them at more risk. Having a history of trauma or abuse, a family history of suicidality, and previous attempts also is a risk factor as well. So we want to be sure that we outline those. Yes, this is a difficult topic, but if we don't bring awareness to it, then we could miss some opportunities to save a life. So that's why it's important. I know it's hard, a hard discussion, but definitely if we want to work towards trying to prevent these occurrences from happening, it is something we have to talk about. right? It is something that we just have to talk about. So, and we also know that the consumption of social media in youth populations has significantly not only degraded the mental health of our youth from excessive use of social media, or maybe not offsetting positive narratives or positive interactions, not, their social media interactions, which are a lot of the times largely negative. They are, continue to consume. You think of yourself as an adult, all the negative things you consume. Now think about cyberbullying and things that's a lot more common among kids that can happen, and just how ugly kids can be. A lot of times they're just as ugly as some of the adults can be, and sometimes worse, right? So definitely allowing your kid to consume excessive amounts of time of unmonitored social media perusing definitely is a risk factor. And we know that from last month when we were talking about the statistical analysis of like the increase of suicidality in young preteens and teens, when we were discussing and unpacking that documentary, The Social Dilemma. Okay. We know that preteen girls is exponentially, like the occurrences of attempts and completions are increasing rampantly with preteen girls and teen girls. Not to say that teen boys don't also, it's not also ramping, but we saw the most the steepest increase with preteen girls and teen girls. Okay, so that's where we saw a lot of that. Let's see. No, I haven't heard about those. Okay, so that is that. As far as that, do y'all have any questions about the risk factors or warning signs for youth? Things to look out for. Do y'all have any questions? And if y'all could increase the shares, we only need 20 more shares, and we got 10K likes. Yay! So excited. Do you think we could get to 20K? Do you think we could get to 20K? If y'all could share, we only need 20 more shares. And if you could tap for 10 seconds, 20 shares, tap for 10 seconds, that's something. If y'all could also share on our other platforms, because again, the whole goal is to increase awareness. And the only way we can do that is by getting the word out. So if you can help us get the word out around this, it could be very helpful to someone. So if you don't mind being a part of the effort to break the stigma around mental health and wellness, please share the live. And please share 2 different methods of sharing. Maybe share on the platform that you're on, but also copy and share the link. If you're in our community, you can go to the community text thread and simply copy and paste that into another text message to someone, a DM or messenger to someone. Maybe somebody with that has a child, or maybe somebody that works with children, like a teacher or a mentor, or maybe a provider that works with children that you might know. Maybe you know a pediatric nurse, maybe you know a school teacher. Share it to people like that, because they also need to be informed as well, not just parents, okay? Also, the other stakeholders in our children's lives need to be aware as well. So if you could share, please, if you could share, get the word out. And even if they don't watch it now, they'll be able to go back and watch the replay, especially if you are in our community and you've shared, or on our social media platforms. that they can do replays, such as like Facebook or Instagram. Okay, so definitely do drop it in their DM so that they can come back later when they see the message and take a look. Okay, perfect. Y'all are working hard over here. I appreciate y'all. All right. So no questions about the warning signs. We've talked about the statistics. We've talked about the warning signs and risks. All right, let's talk about let's see. All right, so let's talk about, we talked about like direct help last time with Dana when we talked about community involvement. But let's talk about more general, like government involvement and things of that nature. Okay. So NAMI, which is National Alliance of Mental Illness, that's puts out a lot of mental health resources in general. But let's look at what NAMI has to say. So this is a couple years old, but NAMI applauds the release of Youth Suicide Prevention Blueprint, a practical resource that outlines clinical pathways, community partnerships, and policy recommendations to better identify and support youth at risk of suicide. It is intended to help pediatric health clinicians, policymakers, and advocates in addressing the rising rate of attempted suicide and suicidal thoughts among youth and young adults. So the goal here outlines the blueprint. So blueprint users will find that the document offers both steps to the local level and broader recommendations. And this comes from NAMI.org, again, National Alliance of Mental Illness. We have NAMI groups, not like we Yellowbird, but in the field there, there's NAMI. If you go to NAMI and your local NAMI, your local NAMI organization, they have free mental health groups. Okay, increase access to affordable, effective mental health care for youth. So I'm happy to say at Yellowbird Counseling, we offer that because we do offer free therapy. So things of that nature, but specifically for youth, having affordable access and easier access to mental health care is something that can happen on a community level, a wider community level. Building a robust mental health and behavioral health workforce. So in areas that, like schools and things, having access to mental health care and behavioral health care professionals, which I don't know how realistic that is if the government isn't putting money towards it. That's why, again, like we were talking about last time, who you vote for is important. What efforts have they done, or do they have they done in the past, and what are they saying they will do in the present or in the future to assist with aiding and development of mental health efforts on a government level, whether that's local government or federal government. Fostering healthy mental health and emotional development in children, just overall, and that's going to take education from parents, especially with, I'll say in the BIPOC community, where healthy mental health engagement is not necessarily what we are used to as a community, and haven't been given as a community. So letting people know that that's something they can even ask for is very important. That's why sharing the live is very important. Developing a stronger understanding of current disparities in youth suicide prevention. And then you can go to AAP press release on the topic. But also, like I said, so you can go to NAMI.org, APA.org, and then youth.gov. Youth.gov is another website where you can get more information. There's also the National Suicide Prevention Hotline, our Lifeline. And then Suicide Prevention Lifeline.org. Those are some of the resources that we talked about last week. So we talked about the warning signs already. We talked about the means that youth use. Let's see what else. We talked about NAMI's, the Youth Suicide Prevention Blueprint. And if you go to NAMI.org, you can just click on the hyperlink to Suicide Blueprint for Youth and Suicide Prevention. And it has a more detailed description of the blueprint and more information about it. And also a video for other stakeholders that work with children can watch and build their education and awareness around youth suicide prevention. All right. Let's see. We talked about that. I'm just trying to make sure I don't miss any of my articles or any points. And there is a lot of suicide prevention resources for youth, like a lot. And reputable resources that you can use. So then there's even a podcast for those of you who like podcasts. It's called Mental Health Matters Podcast. And there's a specific episode called Understanding and Preventing Youth Suicide. Okay. Some of this stuff is kind of heavy, so I'm just giving y'all, I'm really trying to just give y'all the scratch the surface. I feel like that's enough because it is a very hard topic. So I feel like, just kind of scraping the surface with that is really good. Just guiding you to the resources, letting you know about the warning signs, and letting you know about the risk factors is good. And just how to educate yourself, just pointing you in that direction is more the goal than to present jarring information about youth suicide engagement, right? It's just hard. It's a hard topic. So I was leaving some things out that might not necessarily be beneficial. Yes, Mental Health Matters Podcast. Okay, and that particular episode was talking about prevention and youth suicide. Okay, y'all only got 7 more shares. Can y'all do 7 more shares? And can we get 7K more likes? Can we do that? Right, because this is good information. Y'all be sharing mess. Can y'all share helpful, educational, wholesome information as much as you share mess? Can you? All right. Perfect. So what kind of questions do y'all have? What kind of questions? Any questions? Oh no. Oh no. Oh no. Okay. What kind of questions do y'all have? None? No questions? No questions? All right. Well, y'all know what it's time for. It's time for the Cash App giveaway. Over here, I'm only gonna do the 15. So I'm gonna put the, oh, y'all made it to 40, over 42 shares. Yay! This is sub only. So what I'm gonna do is put the chat on sub only. Sub only. And only put your Cash App in the comments one time. Don't put it more than once. Even if it filters it, don't put it again. Okay? Don't put it again. We will see it. Let me do sub only chat. There. Sub only chat. So only put your Cash App in the comments once. Okay? Only once. And even if it filters it, only put it in there once. Okay? I will see it. I promise. Only put it in there once. I'll see it. Let me go get something to write with. Y'all know I never bring that. All right. Yeah. I feel like it's been a minute since we did a Cash App giveaway, guys. I feel like it's been a little minute since we did it, so I'm kind of excited. It is going to be more than $100. I'll let you know that. Okay? Right? Okay. I'm going to start over here, and then we'll work this way. All right? So I'm going to get one. I will say your name and your number 2 times, so get your ears ready, because I will say your name and your number 2 times. Okay? If I mess it up, I will say it a 3rd time, because that will have been my fault. So I will say it a 3rd time if I stumble over your name. Okay? Let me start over here first. All right. Malika Cole, number 1. Malika Cole, number 1. Toya Betts, number 2. Toya Betts, number 2. Alexis Carl, number 3. Alexis Carl, number 3. Every Day, number 4. Every Day, number 4. Christy Davis, number 5. Christy Davis, number 5. Okay. Let me start over here. All right. Shell, number 6. Shell, number 6. Nene, number 7. Nene, number 7. Wait. Okay. What is this one? Let me see. Who's this? Chris Cass 86, number 8. Chris Cass 86, number 8. Big moderator Danielle, number 9. Big moderator Danielle, number 9. Cosmic, number 10. Cosmic, number 10. Chrissy, number 11. Chrissy, number 11. Hold on. What is this one? Reiki Sima, number 12. Reiki Sima, number 12. Big moderator Page, number 13. Big moderator Page, number 13. Crystal, number 14. Crystal, number 14. And I got Shell already. Okay, I think I got everybody, all the subscribers. If you're a subscriber and you did not get a number, let me know now or forever hold your peace. Let me know now or forever hold your peace. Okay, Shar, number 15. Shar, number 15. Okay. I didn't get Mama Nee? Uh-oh, let me see. Mama Nee, did I miss you? Let me see. Okay, well, Mama Nee is number 16. My big moderator, Mama Nee, is number 16. Didn't want to miss Mama Nee. Okay, did I get everybody? I hope I got everybody at this point. Did I get everyone? Okay, so let me pull it up. Let me pull up. Hold on, y'all. Man, I made this big and I didn't mean to make this big like this. How can I make it small? Okay. All right. There. All right. Let me pull up the other. Everybody remember your numbers now. I'm going to pull up. Okay. Let me pull it up. Let me share my screen over here. First, I'm going to share the tab so we all can see it together. So everybody knows it's fair. Okay, I'm going to turn y'all around so you can also see it and know that it's fair. So we're going to do random number wheel generator. So just pick this one. The minimum is 1 and the maximum is 14. Wait, no, it's not. 16. Hold on, let me look again. That's why I take the tally. Yep, 16. The maximum is 16, okay? So let us do 16. All right, y'all. Now we're going to, hold on. I always forget to share that screen instead. Okay. All right, everybody sees the same thing. We're going to click spin. Good luck, everybody. Drum roll, please. Number 4. Oh my gosh. Number 4. Who is that? Who is number 4? Who is it? Who's number 4? Let me see, because I think who is number 4? Hold on, we gotta see who it is. Every day. Wow, congratulations. Every day. Congratulations. Let me go ahead and send it. $200. $200. I'm going to do 200. Congratulations, every day. Who is this? Thank you so much for this is a donation, I believe. Thank you so much for the donation. So much. This person has donated before and it has been anonymous, so I don't want to say it. If you want to say who you are, you can in the comments, but I appreciate it. Thank you so much for the session donations. Yeah, I'm pretty sure this person has donated before. Hold on, guys. Let me go back. Sorry, every day got distracted. $200. $200. Let me pay. Every day you won before, haven't you? You have. Yep, you have. Let me put it in. Yep, every day has won before. Congratulations from Yellowbird Counseling with the 3 dots. Perfect. Yay. Congratulations, every day. How many times you won? Every day has won 3 times. Wow. Pretty cool. And you've won the high number. Every time you win, it's always more than $100 each time you've won. That's cool. Good. Congratulations. All right, y'all. So next week we will be back. I think next week, let me see. Let me look up our calendar. Because I think next week starts our getting people prepared for SAD season. Yeah, next week we'll be getting prepared for like SAD season, seasonal affective disorder, how to cope through that, because some people, it looks like we're on a subwave. Are we going to meet the subwave? Are we going to meet it? But we're going to start talking about seasonal affective disorder because October begins SAD season. That's where some of you notice you feel more sad and down and more tired and stuff in the winter months. That is what we will be addressing. Okay, we'll be addressing that. So we'll be starting that next week and talking about different things that will align with fall and winter mental health, things that need to be discussed. So yeah. Let's see. Let me get back over here so I can see y'all. Yes. So we look forward to having y'all back next week, right? And for those of you that may need our services or would like to share our services, you can take a screenshot of this to have your friends, family members, coworkers, or healthcare providers that may need to send us referrals. They can text the word new to this number, 205-964-5201. Again, that's 205-964-5201. You can text the word new. If you're looking for free services, you will text the word intern to 205-964-5201 if you're looking for free therapy. Okay? All right. So we will see you guys back here next week at 8 p.m. next Thursday at 8 p.m. Central Standard Time, which is 9 p.m. Eastern, which is 6 p.m. Pacific, which is 7 p.m. Mountain.